Welcome. Substance misuse is a challenge that affects individuals, families, and communities worldwide. Now, early recognition and intervention can make a significant difference in someone's life. Today, we'll talk about identifying warning signs, reducing the stigma, and seeking professional help earlier. Hello, and welcome to today's webinar on recognizing early signs of substance misuse. I am Shalmi, a clinical psychologist. I am glad to have you all here for understanding the substance misuse and its warning signs in UK. Substance misuse involves the harmful and hazardous use of psychoactive substances, including alcohol, prescription drugs, and illicit drugs. It is a growing concern in the UK, affecting individuals across different age groups, socioeconomic backgrounds, and various regions. Now, we need to understand the prevalence of substance misuse in the UK. In England, approximately 3.1% of the adults exhibit the signs of drug dependence, with men being 4.3% being more likely to be dependent on illegal drugs than women, who are 1.9%. In 2022, an estimated 313,000 adults in UK were receiving structured treatment for substance misuse, which is a huge number. Scotland has the highest rate of drug-related deaths in Europe, with 1,051 fatalities in 2022, accordingly 36.7 deaths for people. Cannabis remains the most commonly used illicit drug, with 7.4% of adults at the age of 16 to 59 years old reporting the use in the past year, while cocaine among young adults has risen to 6.5%. Now, alcohol dependency affects 1.4 million adults in England, but only 18% of those in need receive the treatment that is required. Drug-related hospital admissions have increased by 19% over the past 5 years, with over 20,000 cases reported in 2022 in England alone. Now, we need to identify the behavioral and emotional warning signs. Understanding the early signs of substance misuse is very essential for prevention and timely intervention. Now, we need to understand what are the behavioral warning signs. These can be withdrawal from the families and friends, sudden disconnection from loved ones, or it can be unexplained mood swings, increased irritability, or sudden personality changes. Substance use can affect emotion regulation as well. Now, frequent lying or secrecy, covering up the activities related to substance use, can also be a sign. Changes in the routine, such as skipping school, work, or social environments, can also be an alarming situation. Now, there are increased risk-taking behaviors like driving under the influence or engaging in unsafe activities. A decline in work or school performances. 21% of employees in the UK report workplace absentees due to substance misuse, and this was according to the UK Centre for Workplace Wellbeing. Let us consider some of the emotional warning signs as well, as they can be heightened anxiety, depression, or paranoia. Studies indicate that 70% of the people in substance misuse treatment in the UK have co-occurring mental health conditions, and this was according to Public Health England report. It can also be avoidance or accountability, reluctance to take the responsibility for the actions, sudden bursts of aggression or emotional detachment. Let me discuss some of the physical warning signs too, like bloodshot eyes, slurred speech, or noticeable changes in weight or appetite. Now, frequent illness or poorer hygiene can also be a sign, like chronic substance misuse weakens the human immune system. Track marks, burns, or bruises on the body, potential indicators of drug injections or other forms of substance abuse, can also be seen. There can be some kind of social and financial indicators of substance misuse as well. Since substance misuse does not only affect the individual, it has also wider social and financial implications. like it can increase the conflicts within the family or friends, strained relationships, and it can also cause social withdrawal. Borrowing of money frequently, selling the personal belongings, or unexplained financial distress can also be a reason. Theft or financial fraud to fund substance use in the UK. Drug-related crimes account for 30% of all reported theft and burglary cases. Homelessness risk. 45% of the UK's homeless population has a substance use disorder history. But the question is, what is the importance of early detection and intervention? Recognizing these warning signs early is crucial to prevent the social misuse from escalating into dependence. Now, early intervention also reduces the long-term health risks. Integrated support programs can reduce the addiction relapse rates by 40%, and this is the report by UK Addiction Recovery. Youth-focused prevention programs in schools have been shown to reduce substance misuse by 28% among at-risk students, and this was a report by UK Substance Use Recovery Use Survey. We need to understand that community engagement reduces the substance-related crime. Neighborhoods with active intervention programs experience a 20% lower rate of drug-related crimes. Workplace wellness programs increase recovery rates, and this increase is up to 70% of the UK employees who have received workplace-based addiction support, and they remain sober after 1 year. How can we break the stigma? Encouraging open conversations is one of the biggest barriers to seek help for substance misuse, and this substance misuse is then considered as a stigma. Over 60% of the individuals struggling with substance use in the UK do not seek any treatment due to the fear of being the social judgment. Ethnic minority groups and the LGBTQ community are at higher risk of facing the discrimination in healthcare settings, making them less likely to access the substance misuse services in UK. And this was the Equality in Healthcare report back in 2023. Now, we need to understand that faith-based and cultural beliefs can prevent individuals from discussing the substance use issues, particularly in South Asian and Black communities in the UK. So, we need to understand that taking action for a healthier society is important. And this can be done by reducing the stigma, by increasing the awareness, and by providing better access to early intervention. We can mitigate the long-term effects of substance misuse. So there are some key steps that we need to follow. The first and most important is we need to educate individuals and communities about the substance misuse warning signs. We need to expand the mental health and addiction treatment services to meet the increasing demands of the affectees. Promoting the open conversation in schools, workplace, and families could be very encouraging. We need to encourage the government investment in rehabilitation and prevention programs. Encouraging the open conversations and reducing the stigma around the substance misuse can lead to more individuals for seeking help. Now, there is the importance of self-assessment and professional consultation when recognizing the early signs of substance misuse is and this is going to be one of the best and the biggest step. Now, self-assessment plays a critical role in helping the individuals to identify the problematic patterns into their substance use and determine whether professional help is needed or not. Now, in the UK, 1 in every 4 adults who misuse substances do not recognize their usage as problematic, delaying the intervention and treatment as well. But the question that arises is why self-assessment matters. The self-assessment is essential for acknowledging a potential problem and understanding its effects on the mental health, the relationships, work, and along with that, the overall well-being. Several researchers have suggested that 80% of individuals who engage in early self-assessment and intervention have better long-term recovery outcomes. Now, the key questions that we could ask for self-assessment to yourself or to the person who is suffering can be the first one. Do I use the substances to cope with stress or anxiety or emotional distress? Has my substance use negatively impacted my relationships, family, or work? Or you can also ask, do I experience withdrawal symptoms such as irritability, headaches, nausea, or shaking when not using the substances? One can also ask, have I attempted to cut down or quit but found it difficult to do so? You can also ask, do I need to use more of the substance over the time to achieve the same effect? Or do I hide or lie about my substance use to others? Or has my financial situation worsened due to spending on substances? So, if you answered yes to 2 or more of these questions, it may be time to seek professional help. There are certain self-assessment tools available in the UK. Let's take an example. The Alcohol Use Disorders Identification Test Audit, which is used by the NHS to screen for alcohol dependency. Then there is a drug abuse screening test that is called DAST, a brief tool to identify drug-related problems. Then there is Frank Online Self-Assessment Quiz, a government-supported tool that is offering guidance on substance use patterns. Then there is an NHS Mind Check-In, a mental health and addiction self-evaluation tool. But important question is why professional consultation is essential. Self-assessment provides initial awareness, but professional consultation ensures accurate diagnosis and treatment in the UK. Only 38% of the individuals struggling with substance misuse seek professional help due to stigma and lack of awareness. This was the report by Addiction Treatment Centers. Now, early intervention more often improves the recovery rates by up to 60% when individuals access the professional support or professional help. Waiting times for NHS addiction services have ranged from 2 to 12 weeks depending upon to the region, but the urgent cases can access crisis intervention services, which is a very good way to get help. Now, we need to understand that we have to break the stigma. And in order to break the stigma, what we can do, we have to study that as well. So over 60% of the people struggling with substance misuse in the UK avoid the seeking help due to the fear of judgment as mentioned earlier. And then faith-based and cultural beliefs can also create the additional barriers for some communities, making access to the non-judgmental support more crucial. We need to understand that mental health and addiction should be treated together. Integrated programs have higher success rates in long-term recovery. Recognizing the need for help is not a sign of weakness, but a step towards the recovery. So by encouraging the self-assessment and professional consultation, we can reduce or sometimes eliminate the burden of substance misuse. And along with that, we can improve the well-being of individuals and communities across the UK. Now, why the professional consultation is essential? While self-assessment is a great start, professional guidance provides accurate diagnosis and personalized treatment and long-term support. There are some benefits of consulting a professional. And those can be like early intervention prevents further health and social consequences. It can also help to get personalized treatment plans which are tailored strategies for detox, therapy, and above all, relapse prevention. Mental health support will help to identify many substance use disorders, which are coexisting with like anxiety, depression, or sometimes trauma. Accountability and encouragement will create a support system that increases the success rates in the recovery. Now let us understand how we can seek help. Once you or someone you know identifies potential issues or potential risks, consulting a professional is critical. Professionals can conduct screenings, provide a clear diagnosis, and offer tailored treatment options. Now, early professional involvement can make recovery much more manageable. So, reaching out for help may feel overwhelming, but many resources are available for that as well. So, the first resource that you could use are the doctors and therapists. that can assess severity and recommend the treatment options to you. Second option is rehabilitation centers and support groups. They offer structured recovery programs. Then you have helplines and online resources that actually provide you the confidential support which is available 24/7. Do you understand that seeking help is not a sign of weakness, but a step towards strength and recovery? So if you or someone you know is struggling with substance abuse, take the first step today. Use a self-assessment tool or schedule a consultation with a professional. And remember, recovery starts with awareness and action. Now we need to understand why stigma around the substance misuse has already developed. Stigma around substance misuse develops due to a combination of societal attitudes, cultural beliefs, misinformation, and historical policies. Let us discuss some of the key reasons why stigma persists. Moral judgments and misconceptions are the reason. Many people view addiction as a personal failure rather than a medical condition. This belief stems from outdated ideas that substance misuse is simply a lack of willpower rather than a complex issue involving genetics, mental health, and environmental factors. The reality is that the NHS and the World Health Organization classify substance use disorders as chronic medical conditions that require treatment, just like diabetes, health diseases, or any other disease. Now, media portrayals of actions are different. Movies, TV shows, and news reports often depict people with substance use disorder as criminals, homeless individuals, or morally corrupt people. This reinforces negative stereotypes and makes it harder for people to seek help. Let's take an example. The UK media's focus on scroungers and drug abusers during political discussions about social welfare contributes to public resentment toward individuals with addiction. There is criminalization of drug use. For decades, drug use has been treated as a legal issue rather than a public health concern. Harsh drug laws like the UK's Misuse of Drug Act 1971 has led to the punishment of people with addiction rather than offering them the treatment. And its impact, many people have faced the legal consequences if they seek help, especially in marginalized communities. A 2023 UK drug policy report found that criminalized individuals are 60% less likely to access rehab services due to fear of legal repercussions. There are some cultural and religious beliefs attached to it as well. In some religious and traditional communities, substance use is seen as a shameful, sinful, or a sign of weak character. This can make it difficult for individuals to admit that they have a problem, or they do not ask for help. In certain conservative UK communities, addiction is viewed as a family disgrace, which is leading individuals to hide their struggles rather than seeking help or seeking support. Now, there is also a problem of lack of education about addiction. Many people don't even understand how addiction works. They assume that stopping substance use is simply a matter of choice, without recognizing the biological and psychological dependency that develops and persists. Researchers have shown that addiction alerts the brain functioning, particularly in the areas that control the decision making or impulse control, and more often emotion regulation. There is an association with violence and crime of this drug abuse. Because some substance-related crimes like theft or drug dealing, it occurs when people often associate addiction with dangerous behavior. And this generalization fuels fear and discrimination against all the people with substance use disorders, even those who are non-violent. Some statistics shows that in the UK, only 16% of the drug-related offences involve violence, but the public perceives the risk as much higher. Workplace and social consequences are there as well. Many employers hesitate to hire the individuals with a history of addiction, fearing unreliable or fear of relapse. Families may distance themselves from their loved ones who are struggling with substance misuse, leading them to go into isolation and shame. Health professionals sometimes show biasness, assuming that the individuals with addiction are non-compliant or difficult to treat or handle. We need to understand that breaking the cycle of this stigma is very important, which can be done by education and awareness campaigns that can help change public perceptions. This can be done by decriminalization and harm reduction policies, encouraging treatment over punishment. Or personal stories of recovery can shift attitudes and humanize the issue. Reducing the stigma around the substance misuse is very important, as the stigma remains one of the biggest barriers to seeking help for substance misuse in the UK. Many individuals fear judgment, discrimination, or social rejection, which actually prevents them from accessing the life-saving treatment. In fact, a 2023 study by Public Health England found that 57% of the people struggling with substance misuse delayed seeking help due to the stigma. Now we need to understand the impact of the stigma in the UK. Did you know that 1 in 3 individuals with substance use disorders in the UK report feeling isolated or discriminated against due to their conditions? 60% of the people in addiction recovery say that stigma negatively impacts their job prospects. And only 38% of the individuals who are struggling with addiction seek the professional help, often due to the fear of being judged. Stigma is higher among the people who concerned or who are related to ethnic minorities or LGBTQ individuals, who report additional cultural and social or societal barriers to seeking treatment. Breaking the stigma means normalizing the idea of seeking help, just as no one should feel ashamed for getting treatment for diabetes or heart disease. People should feel comfortable reaching out for support while dealing with the substance misuse along with other diseases as well. Let us discuss some of the ways of reducing stigma around the substance misuse. The first and the most important that we can consult is educate yourself and others. Substance use disorders are medical conditions, not moral failures. The UK government recognizes addiction as a health issue rather than a crime in its latest drug strategy report 2023. Addiction alters brain chemistry, requiring medical treatment and psychological support. Challenges, myths and misconceptions such as addiction is a choice, when you hear them, needs to be taken care of. Use supportive and non-judgmental languages, like avoid using the terms like addict or junkie, which carry negative connotations. Instead, use person with substance use disorder. This will help to emphasize the individuals rather than their condition. The UK government's Reducing Stigma initiative back in 2023 encourages health professionals and media to use non-stigmatizing language in addiction treatment and reporting. We need to promote compassion over judgment. 80% of the individuals with substance use disorders have underlying mental health conditions such as anxiety or depression. We need to recognize that addiction is often linked or associated to the trauma or genetic predisposition or socio-economic factors. Treat people with addiction as you would someone with a chronic illness like asthma or diabetes or any other heart disease. We need to encourage the open conversations. Now, talking about the substance misuse without being judging or without judgment makes it easier for the individuals to seek help. We need to incorporate substance misuse education in the schools, in the colleges, in the universities, and programs like Talk to Frank help the teenagers to understand the risks and seek the support they require. We need to share the stories of recovery. Our Recovery UK survey has found that 67% of the people in recovery felt inspired by hearing others or their success stories. We need to build support policy and treatment accesses. We need to advocate for better access to treatment and harm reduction services, specifically in unserved communities or marginalized communities. We need to understand that supporting the harm reduction policies, these are the needles that exchange programs and supervise drug consumption rooms, which have reduced the overdoses by 50% in some of the UK regions. This was a report by Public Health England 2023. We need to encourage non-judgmental healthcare approaches. Now, the people receiving compassionate care are 3 times more likely to complete addiction treatment as compared to the one who are not receiving it. We need to engage with the people in recovery, and that can be done only when we listen to their experiences without being biased or without judging them. We need to support the peer recovery program, provide the support peer recovery programs and mental health services. Now, over 70% of the individuals find peer-led support groups very helpful for their recovery. Let us recognize that recovery is a long-term process and not a one-time event. By challenging this stigma and using the respectful language and supporting the policy changes, we can create a more sustainable, a more compassionate society where the individuals feel safe and secure while asking or seeking for the help. There are several local and online resources available that would be helping us for screening and support the recognizing and addressing of the substance misuse. Recognizing this issue is crucial for individuals' well-being and public health as well. Now, in the UK, numerous local and online resources have provided screening, support, and treatment for the individuals along with their families who have been affected by addiction or any other substance misuse. There are several key national resources in the UK that could be of great help to all of the people who are suffering. Among them are NHS Drug and Alcohol Services, which are free treatment programs across the UK, offering counselling, detox and rehabilitation. Frank is another one, a UK government initiative which is providing confidential advice, educational resources and self-assessment tools as well. The third one that you can consult is We Are With You. This is again a UK-based charity which is offering free and confidential support for drug and alcohol issues. Another one you can access is Alcohol Change UK. That supports the individuals which are concerned about their drinking habits and offers access to professional help. Another one that you can access is Mind UK. That actually provides the mental health and addiction resources, recognizing the link or the association between the substance misuse and psychological well-being. There are certain local drug and alcohol services in the UK. Many local councils offer the specialized addiction treatment services. Among them can be the one that is London Change, Grow, Live, CGL. These are the services that supports the recovery through harm reduction. Harm reduction programs and therapies have been established by them. Another one is Manchester Achieve Drug and Alcohol Recovery Service. Now, this program actually offers the medically supervised detox, therapy and community outreach. The third one you can have is Scottish Drugs Forum, SDF. That provides support for those who are affected by the substance misuse. Another one is Wales, Barrett Drug and Alcohol Services, that offers youth-focused and family support system. There are several self-assessment and online screening tools. Among them are Alcohol Use Disorders Identification Test, the Audit, which is a government-backed tool to assess drinking and their drinking habits and the risk associated with it. Then we have Drug Abuse Screening Test, DAST, which is a quick assessment to evaluate the drug use. We can also have an online access to Mind Check-in, which is an NHS tool that evaluates the mental health and addictions concerned with it. Now, for immediate concerns, you can contact a general physician or local mental health service. That is going to be the best in the first part. General physicians can provide personalized advice and refer individuals to specialist addiction services. Encouraging the loved ones to seek help is very important. Supporting a loved one struggling with substance misuse can make a significant impact on their decisions or decision making regarding seeking the help. Be patient and non-judgmental. 45% of the people in addiction recovery in the UK says and express that compassion from a loved one motivated them to seek the treatment, and that is actually a UK recovery survey in 2023. We need to share the trusted resources with them because knowledge is power, and providing the information about treatment options can encourage someone to take the first step. We need to simply start a conversation. A simple sentence, "I am here for you," can open the door to recovery. A compassionate approach to recovery is very important. And for that, we need to understand that seeking help for substance misuse is a sign of strength and not that of weakness. We need to understand that reducing stigma and expanding the treatment access and supporting the individuals in recovery can transform their lives at a massive level. Together, we can create a more supportive and understanding society for those who are being affected by addiction. I really would like to thank you all for hearing me out today on recognizing the early signs of substance misuse. I now hope that you feel equipped to identify the warning signs that are related to substance misuse, and you also understand the importance of early intervention, how and why it can help a person suffering from substance abuse. Substance misuse doesn't have to define someone's future. There is always help available. So, if you or someone you know needs further support, feel free to reach out to us. Together, we can work forward healthier and stigma-free communities. Thank you so very much for your day today.